1. Which principle of adult learning is most important when designing OSCE stations to ensure learner engagement? A. Learners prefer passive observation. B. Learners are motivated by immediate application. C. Learners avoid experiential tasks. D. Learners require minimal feedback. 2. What is the primary goal of using standardized patients in OSCEs? A. Reduce faculty workload. B. Provide consistent, reproducible scenarios for all candidates. C. Eliminate the need for assessment rubrics. D. Replace written exams entirely. 3. Which evaluation method best determines whether OSCE training improved clinical decision-making skills? A. End-of-course multiple-choice test. B. Long-term follow-up of clinical performance indicators. C. Counting the number of OSCE attempts. D. Self-reported learner satisfaction. 4. When writing OSCE station checklists, what should be prioritized to ensure validity? A. Inclusion of as many tasks as possible. B. Alignment with learning objectives and clinical competencies. C. Focus on easily observable behaviors only. D. Minimizing inter-rater reliability concerns. 5. Which communication skill is most critical for assessors to maintain fairness during OSCE scoring? A. Avoiding nonverbal cues that influence performance. B. Using technical jargon frequently. C. Discussing candidate errors during assessment. D. Providing verbal hints during the station. 6. What is the most effective way to evaluate the reliability of OSCE scores across multiple stations? A. Review a single examiner's notes. B. Calculate inter-rater reliability and generalizability coefficients. C. Compare OSCE scores with attendance records. D. Survey students about their experience. 7. Which adult learning principle supports providing immediate feedback after an OSCE? A. Readiness to learn is not time-sensitive. B. Adults are motivated by delayed reinforcement. C. Timely feedback enhances performance and retention. D. Adults prefer to self-discover without feedback. 8. What is the most appropriate first step when developing a new OSCE curriculum? A. Select standardized patients. B. Write scoring rubrics. C. Conduct a needs analysis of required clinical skills. D. Schedule examiner training. 9. Which regulatory consideration is critical in OSCE implementation? A. Ensuring psychometric defensibility of results. B. Minimizing the number of stations. C. Using subjective rating scales without calibration. D. Avoiding legal documentation of results. 10. Which evaluation approach measures the impact of OSCE performance on actual workplace behavior? A. Kirkpatrick Level 3 evaluation. B. Norm-referenced assessment. C. Criterion-referenced checklist only. D. Diagnostic pretest. 11. What is the best mentoring approach for learners who consistently underperform on OSCEs? A. Provide constructive feedback with targeted practice opportunities. E. Avoid discussing weaknesses to preserve confidence. C. Assign additional reading only. D. Recommend immediate retake without remediation. 12. Which feature of OSCE stations best promotes fairness across candidates? A. Variable time limits based on candidate preference. B. Standardized instructions and scoring criteria. C. Allowing improvisation by examiners. D. Randomized assessment criteria. 13. What is the primary purpose of blueprinting in OSCE design? A. To determine the order of stations. B. To align station content with curriculum objectives and weightings. C. To select the most convenient skills to test. D. To minimize examiner training requirements. 14. Which communication technique is most effective during examiner calibration sessions? A. Passive listening without interaction. B. Consensus discussion of scoring discrepancies. C. Silent observation of candidate videos. D. Allowing each examiner to use personal judgment without comparison. 15. Which curriculum development step ensures OSCEs reflect real-world practice? A. Reviewing current clinical practice guidelines. B. Copying stations from another institution. C. Limiting scenarios to rare conditions. Avoiding stakeholder input. 16. Which factor most strongly influences OSCE reliability? A. Number of stations and assessors. B. Use of open-ended questions. C. Short station duration. D. Candidate familiarity with format. 17. Which type of feedback is most effective for improving clinical communication skills assessed in OSCEs? A. General comments without examples. B. Immediate, specific, and behavior-focused feedback. C. Feedback given weeks after the exam. D. Peer comments without structure. 18. Which method is best for validating new OSCE station content? A. Expert panel review and pilot testing. E. Single faculty member approval. C. Using previously untested scenarios without review. D. Randomizing station content without feedback. 19. Which adult learning principle explains why OSCE participants benefit from self-assessment checklists? A. Adults dislike reflection. B. Self-directed learning enhances accountability and performance. C. External feedback is the only motivator. D. Learning is best when passive. 20. Which regulatory compliance issue is most important when recording OSCE sessions? A. Ensuring data storage complies with privacy regulations. B. Limiting storage time to 1 day. C. Sharing recordings freely with peers. D. Avoiding written consent. 21. Which mentoring technique is most appropriate for helping anxious learners prepare for OSCEs? A. Encourage avoidance of practice sessions. B. Provide supportive rehearsal opportunities and coping strategies. C. Minimize discussion about the OSCE. D. Criticize poor performance harshly to build resilience. 22. What is the most effective way to reduce inter-examiner variability during OSCEs? A. Provide calibration sessions and standardized scoring rubrics. B. Allow examiners to develop personal criteria. C. Rotate examiners mid-station. D. Shorten examiner training. 23. Which evaluation tool best measures learner confidence after OSCE training? A. Likert Scale Self-Efficacy Survey. B. Objective Structured Checklist. C. Direct observation of clinical tasks. D. Knowledge-based written test. 24. When mentoring junior faculty to become OSCE assessors, which approach is most effective? A. Pairing them with experienced assessors for co-rating. B. Allowing them to assess independently without preparation. C. Providing written instructions only. D. Focusing on administrative tasks rather than assessment. 25. Which communication method ensures learners fully understand OSCE performance expectations? A. Posting criteria after the exam. B. Sharing scoring rubrics and station objectives in advance. C. Keeping assessment criteria confidential. D. Relying on word-of-mouth explanations. 26. Which type of evaluation is conducted while OSCE stations are still being developed to improve quality? A. Formative evaluation. B. Summative evaluation. C. Norm-referenced evaluation. D. Criterion-referenced evaluation. 27. Which principle of curriculum development helps avoid redundancy in OSCE stations? A. Content mapping and blueprinting. B. Random selection of skills. C. Faculty preference polling. D. Ignoring overlap considerations. 28. Which factor best ensures that OSCEs measure higher-order clinical reasoning skills, including complex integrated patient scenarios? B. Using checklist items limited to basic recall. C. Keeping tasks purely procedural. D. Minimizing decision-making elements. 29. Which adult learning factor most supports learner motivation in OSCE preparation? A. Clear link between OSCE tasks and real clinical roles. B. Repetition without explanation. C. Requirement to memorize unrelated facts. D. Lack of practice opportunities. 30. Which approach best ensures fairness when a candidate requests accommodations during OSCEs? A. Follow institutional policy and provide reasonable accommodations. B. Allow examiner discretion without documentation. C. Ignore the request to maintain uniformity. D. Give extra time only if majority agree. 31. Which mentoring outcome demonstrates program success in OSCE preparation? A. Increased learner confidence and improved scores. B. Higher mentor workload. C. Lower attendance in practice sessions. D. Reduced number of feedback sessions.